Hi, welcome to Crisco's Corner. Proud to live in the greatest country in the world. Unfiltered opinions, no PC discussion here. Agree, disagree, hate it, love it, it's all good. Sit back and enjoy some unfiltered commentary. We discuss politics, culture, interviews, and more. Your comments are always welcome. Please help the channel by hitting that subscribe button. Doesn't cost a thing. And as always, thanks for your support. Hi folks, welcome back to Crisco's Corner. From the New York Post, this guy's a real effing piece of work. Professor gets heat after saying white or elderly should wait for vaccine. Actually, it goes farther than that. You play semantics with words, but people aren't stupid. Let's read on. Let's get this guy's name out in public here, because he deserves the scrutiny. Assistant Professor of Medical Ethics and Health Policy. This is ethics he teaches, medical ethics. Harold Schmidt, University of Pennsylvania. Maybe we ought to send him an email, give him a call, tell him what a piece of blank this guy is. An ethics professor at the University of Philadelphia sparked a heated debate. I love that. By suggesting essential workers should get priority for the coronavirus vaccine over vulnerable senior citizens. That's not what the controversy is about. Because the workers are more likely to be minorities. That's the issue. If you want to have a debate that says the frontline workers should get it first before elderly patients, okay, we can have that discussion. But it has nothing to do with race. Again, the progressive Democrats are the racists. Older populations are whiter, Harold Schmidt told the New York Times. Society is structured in a way that enables them to live longer. Instead of giving additional health benefits to those who already had more of them, we should start to level the playing field a bit. You play these semantics, you jerk. What you're trying to say is to let the older white people die. It's just tell the truth here. This isn't a discussion about elderly people and frontline workers. This is a discussion about white elderly people. The Center for Disease Control should use its own social vulnerability index to decide how to protect older people who are more at risk, Schmidt said. The index uses measures from the census like poverty, unemployment, disability, housing status, and education to determine which communities are more likely to feel the impact of a public health emergency. At least 18 states plan to use the index, he told the Times. At least 221,000 of those who have died of COVID were over 65, or about 80% of the total deaths recorded through Wednesday. And that's the issue with these lockdowns. You want to take vulnerable people because of health issues, and you want to take older people and isolate them and keep them away and keep them safe, fine. That's fine. These draconian lockdowns are not the answer to help elderly people when 80% of the people that have died are over 65. And I'll bet, even though it's not here, I'll bet the other 20%, I'll bet you 90% of those had a very severe underlying health problem. Those over the age of 85 are 630 times more likely to die from the virus than those 18 to 29, which means it's almost zero for that age group. And why aren't the kids back in school? Why aren't the kids back in school? Why? Because the teachers' unions allow them to get paid their full salary, and they get to do this fake stuff online. And then they get to complain about the fact that low-income or poor students can't afford the technology to do online learning. Well, you're the ones causing it. You're the ones. You want to feel safe in a little cocoon in your apartment in New York City? That's fine. We're not going to pay you. It's ridiculous. And you say, well, John, you don't live in New York City. You live in upstate New York, so you got nothing to say about their salaries. Yeah, I do. Because I pay severe taxes into the pension fund. And the pension fund is funded by taxpayers. And so is the health insurance. and the pension they're going to get for 30 years after they retire. Yeah, so I get to say. CDC Director Dr. Robert Renfeld said he believes priority should be given to people 70 and older who live with children or grandchildren, the Daily Mail reported. Even though we know that children are very unlikely to pass it along. If you're over 70, yeah, nursing homes in New York are expected to get vaccines starting Monday. I'm not even going to comment about the death of nursing homes and the governor. It's all been well documented. I really don't want to go into it. Not because I'm afraid. It's because it's depressing. Schmidt's comments provoke criticism for those who point out that nursing home residents can't socially distance and may be of all ages. It's time to call for vaccinating essential and frontline workers first, said commentator Brenda Tippin, who identifies herself as a biologist. But you have to elaborate and identify the elderly population as being wider and point that out as an assumption they had more privileged lives. It's time to level the playing field is inexcusable. Good for you, Brenda. You're right. Should we have the debate about the frontline workers and elderly population goes first? Okay, that's a discussion we can have. But to point out the race of the elderly people, kiss my ass. Sorry. It is inexcusable. And I'll bet you she said more words than that. You just can't print them. Others argued seniors who've been isolated for months on end are literally dying of loneliness, and that he was arguing that elderly are not the only non-essential. They're actually quite expendable. Yeah. And this is the future of medicine, folks. This is the future of the panels that was under Obamacare. Remember the big stink about the death panels? One thing, it's aptly named. Yeah, is it worth the resources to keep somebody going when basically their life is pointless? We're going to have that debate, and we're going to have it real soon. And soon it's going to be policy and maybe even law. Brace yourselves, folks. The future is here. His Twitter mentions were filled with memes that said things like, "All lives matter," and screenshots showing a chart that puts white men at the shortest life expectancy at 76.71 years. I don't understand how you can be considered an ethics professor, posted a user with the handle Porteous Smith. Your worldview is anything but. It's appalling. Yeah. And in fact, white males, their life expectancy in the last decade has gone down. In the United States, of all places, because of bad policies by our government, especially at the federal level and pretty close to second at the state level. All those jobs over the last 2 decades that were shipped out. Remember the North America Free Trade Agreement that Trump fixed so it was workable? We'll never know how workable because of the COVID, but it was working up until then. He redid the whole thing. You know how hard that is? And he got it done. The TTP, that they all screamed about, and then they got caught with their hands in the cookie jar. They pulled it out. Well, that's going to be back, folks. You think a little bit of manufacturing jobs. When I say a little bit, I'm talking about hundreds of thousands of people, so it's not trivial. I say a little bit compared to what we lost. They were starting to come back. And now they're going to be gone. And then what does it have to do with this, John? Well, it does. It's about government policy. And it's about how that the older white males, especially if you're above 40 and 50, have become expendable. They really have. And to a lot of people, they are. And that's just the way these people think. So you ought to give this piece of crap, maybe you ought to send a little message. Give a call to the University of Pennsylvania and Harold Schmidt. You know what the funny part is? I'll bet you all the tweets he put out concerning this didn't get banned or flagged as any accurate information. I'll bet you money. And so it goes, folks. This is what you have to look forward to the next 4 years as social media censors all of us, especially the right of center and conservative people, with the help of our government. What does that sound like? Countries from the past or current countries that don't have a Bill of Rights. Oh, wait a minute. We have a Bill of Rights. Maybe not. Maybe not anymore because they're wiping their asses with it. And there you are, folks. Another piece of work. I'd say something, but I don't want this video to get banned. And until next time, goodbye and good luck.